Is inflammation a disease or a symptom? Inflammation is part of the body's defense mechanism and plays a role in the healing process. Hey everyone, this is Rick here from healthybodiesandminds.com. Hope you all are staying healthy and sane. Let's jump into today's video, which is about inflammation and understanding it after this short intro. When the body detects an intruder, it launches a biological response to try to remove it. The attacker could be a foreign body, such as a thorn, an irritant, or a pathogen. Pathogens include bacteria, viruses, and other organisms which cause infections. Sometimes the body mistakenly perceives its own cells or tissues as harmful. This reaction can lead to autoimmune diseases such as type 1 diabetes. Experts believe inflammation may contribute to a wide range of chronic diseases. Examples of these are metabolic syndrome, which includes type 2 diabetes, heart disease, and obesity. People with these conditions often have higher levels of inflammatory markers in their bodies. Let's find out why inflammation happens, its symptoms, and ways to resolve it. There are two main types of inflammation, acute and chronic. Acute inflammation. An injury or illness can involve acute or short-term inflammation. There are 5 signs of acute inflammation: pain, redness, loss of function, swelling, and heat. Pain. This may occur continuously or only when a person touches the affected area. Redness. This happens because of an increase in the blood supply to the capillaries in the area. Loss of function. There may be difficulty moving a joint, breathing, sensing smell, and so on. Swelling. A condition called edema can develop if fluids build up. Heat. Increased blood flow may leave the affected area warm to the touch. These signs are not always present. Sometimes inflammation is silent without symptoms. A person may also feel tired, generally unwell, and have a fever. Symptoms of acute inflammation last a few days. Subacute inflammation lasts generally 2 to 6 weeks. Chronic inflammation can continue for months or years. It either has or may have links to various diseases, such as diabetes, cardiovascular disease, arthritis, and other joint diseases, allergies, chronic obstructive pulmonary disease or COPD, psoriasis, rheumatoid arthritis. The symptoms will depend on the disease but may include pain and fatigue. How to measure inflammation? When inflammation is present in the body, there will be higher levels of substances known as biomarkers. An example of a biomarker is C-reactive protein or CRP. If a doctor wants to test for inflammation, they may assess CRP levels. CRP levels tend to be higher in older people and those with conditions such as cancer and obesity. Even diet and exercise may make a difference. What are the causes? Inflammation happens when a physical factor triggers an immune reaction. Inflammation does not necessarily mean that there is an infection, but an infection can cause inflammation. Let's talk about acute inflammation. Acute inflammation can result from exposure to a substance such as a bee sting or dust, or even pollen grains, an injury, an infection. When the body detects damage or pathogens, the immune system triggers a number of reactions. Tissues accumulate plasma proteins, leading to a buildup of fluid that results in swelling. The body releases neutrophils, a type of white blood cells, or leukocytes, which move toward the affected area. Leukocytes contain molecules that can help fight pathogens. Small blood vessels enlarge to enable leukocytes and plasma proteins to reach the injury site more easily. Signs of acute inflammation can appear within hours or days depending on the cause. In some cases, they can rapidly become severe. How they develop and how long they last will depend on the cause, which part of the body they affect, and individual factors. Some factors and infections that can lead to acute inflammation include acute bronchitis, appendicitis, and other illnesses ending in itis, an ingrown toenail, a sore throat from a cold or flu, physical trauma or wound. Chronic inflammation. Chronic inflammation can develop if a person has sensitivity. Inflammation happens when the body senses something that should not be there. Hypersensitivity to an external trigger can result in an allergy. Exposure. Sometimes long-term, low-level exposure to an irritant such as industrial chemicals can result in chronic inflammation. Autoimmune disorders. The immune system mistakenly attacks normal healthy tissue, as in psoriasis. Autoinflammatory diseases. A genetic factor affects the way the immune system works, as in Behçet's disease. Persistent acute inflammation. In some cases, a person may not fully recover from acute inflammation. Sometimes this can lead to chronic inflammation. Factors that may increase the risk of chronic inflammation include old age, obesity, a diet that is rich in unhealthful fats and added sugars, smoking, low sex hormones, stress, sleep problems, asthma, chronic peptic ulcer, tuberculosis, rheumatoid arthritis, periodontitis, ulcerative colitis, and Crohn's disease, sinusitis, and active hepatitis. Inflammation plays a role in healing, but chronic inflammation may increase the risk of various diseases, including some cancers, rheumatoid arthritis, atherosclerosis, periodontitis, and hay fever. So, should you ignore them or should you treat them? Treatment of inflammation will depend on the cause and severity. Often, there is no need for treatment. Sometimes, however, not treating inflammation can result in life-threatening symptoms. During an allergic reaction, for example, inflammation can cause severe swelling that may close the airways, making it impossible to breathe. It is essential to have treatment if this reaction occurs. However, without treatment, some infections can enter the blood, resulting in sepsis. This is another life-threatening condition that needs urgent medical treatment. So, inflammations are not always to be ignored. Some of them can be really fatal. That's all, folks, for now. I'll catch a healthier you again in the next one. Don't forget to subscribe to the channel and hit the notification bell icon for more content like this.